But Ugandan mothers, Mwine Mputu Nyingi, we have stopped you from giving your babies this Chiapidon syrup for years now. I saw 2 others today. Many of you are going to come to the comment section saying it works very well for flu. I know it works very well for flu, but using steroids to treat flu in children, especially dexamethasone, is not worth it. The side effects will outweigh the benefits. The Apidon syrup contains 2 components, Piriton, what we call chlorpheniramine, and then dexamethasone, the steroid. Dexamethasone is around 0.5 milligrams in every 5 mils of the syrup. In 125 mils, that's a total of around 12.5 milligrams. This is a high dose. As if the dose wasn't high enough, dexamethasone in general will be the most potent steroid and the one that works for longer. You compare it to prednisolone. If you have 5 milligrams of prednisolone, that's equivalent to just 0.75 milligrams of dexamethasone. And here you are giving the children 0.5 milligrams in every 5 mils of the syrup. You see these steroids, yes, they are very, very powerful drugs. They treat a wide range of illnesses. In fact, they are every doctor's last resort when all medicine has failed and you're not so sure what is going on. But then they have some massive side effects. There's one we call Cushing's disease. If you expose your child to steroids, especially the potent and long-acting ones like dexamethasone, for a long time, they will get Cushing's disease. So you'll find your child not growing normally like other children are growing. Also, he will put on weight, but this weight will be more in the upper body, what we call trunk obesity. And you'll find them with those stretch marks. You know those stretch marks of people who are gaining weight, a lot of weight. They might also have easy bruising of their skin. You'll find their face is now round shape, what we call the moon face. Then, in case you are to suddenly withdraw this medicine after giving it to the child for quite a long time, they get something called adrenal crisis when their body is now craving for that drug. So you'll find them being very weak. You'll find their blood pressure is very low. They might be vomiting. They might even lose consciousness. They will be really sick. This is a child who needs to go to hospital. The side effect is peptic ulcer disease. You know, steroids usually will irritate someone's stomach and they can cause these ulcers, especially dexamethasone, which works for longer and is most potent. So for me to conclude, if you are to treat flu in children, steroids are not usually the best, especially dexamethasone. There are other safer alternatives like the antihistamines, cetirizine, fexofenadine, loratadine. They come in either tablet or even syrup form. If you really want to use a steroid, you should use the intranasal spray. The spray you just spray there. Those ones are relatively safer.